Good morning, welcome back. Do you remember the story we told you last week about this Richmond spine specialist who is making breakthroughs in the world of spinal surgery? Dr. Michael DePalma was recently recognized on the national show CBS Sunday Morning right here on CBS 6, and he's here with us here in studio to talk about this revolutionary treatment. Great to see you, Doctor. Thanks so much for coming in so early.
Thank you.
Dr. DePalma, tell me, 8 out of 10 Americans at some point will be suffering from back pain. Why is it so common?
That's correct. 8 out of 10 will suffer from back pain at some point in their lifetime, with many of those folks developing recurrent or chronic ongoing back pain. And the most common reason for that is injury of a disc in our low back. Now, the disc itself can become injured for a variety of reasons. We're lifting, bending, twisting, and incurs an injury. And then actually the injury doesn't heal completely like it would, say, a cut on our arm or something. So that non-healing injury within the disc becomes chronically painful. Blood vessels grow into it, nerve endings follow the blood vessels, and then we have a setup for both degeneration and chronic ongoing back pain.
Can this be hereditary, or is it really preventable, where you said we're lifting boxes the wrong way or couches the wrong way?
Well, it's a good question. There are three broad factors that play a role in degenerative changes of the spine: genetics, environmental, and biomechanical. So biomechanical would involve the lifting, for example. Genetics does play a role. We're not sure how to read what hand we're dealt as individuals, but that does play a role in development of degenerative changes in the spine.
Tell us about these 4 studies that you were part of in the paper that was just released yesterday that's really gaining some national traction here.
So the paper was a review manuscript published last month by North American Spine Society, reviewing the experimental technologies that are labeled as biologic intradiscal treatments. Biologic meaning the objective is to initiate repair of the disc, of that non-healing wound within the disc. And the different technologies take the shape of injecting growth factors, which are proteins in the disc to stimulate repair, injecting cells, be it stem cells or actual disc cells into the disc to replenish those cells, and then another technology is tissue scaffolding, which is injected in the disc to try to seal the tear and initiate healing of the wound by setting up a scaffold so the cells can proliferate in 3 different dimensions.
Doctor, if somebody is suffering from back pain, what's your advice for them?
Depends on where they are in the spectrum. If the back pain is incapacitating, we might need to intervene pretty quickly with something to reduce their back pain and let them progress further in physical therapy and go about their business. If they're able to function and it's more episodic back pain, activity dependent, then we got to address the activities that are provoking the symptoms, address their biomechanics, maybe look at the ergonomic variables to correct things in a workplace setting that might be bothering them. So it kind of depends on how incapacitating their symptoms are at that moment.
Richmond spine specialist, Dr. Michael DePalma, thank you so much for the information. We appreciate it. Still to come on CBS.